Hello, my name is Crystal Ice, and I am the Chief Creative Director of Taylonis. Welcome to the SpeechMED presentation. I would like to start off by telling you a story. Our CEO, Susan Perry, has a beautiful mother-in-law named Giselle, who was born and raised in Paris. Until recently, she read, wrote, and spoke French as her primary language. She also spoke English and Spanish fluently. When she was admitted to a local hospital a few years ago for pneumonia, her physician changed her blood pressure and anticoagulant to 2 different medications. Her discharge instructions were given to her written in English, which she shoved at the bottom of her bag. When she arrived home, she gave the new prescription to a family member who diligently filled the 2 new prescriptions and gave them to her in addition to her 2 old medications. 5 days later, she was readmitted back into the hospital for several months. Her brain function has never been the same. When Susan asked the CMO of the hospital what had happened, he said that this happens every day. Her mother-in-law's story is not unusual. Let's review some facts. According to the National Caregiver Alliance, more than 65 million people, 29% of the U.S. population, provide care for a chronically ill, disabled, or aged family member or friend during any given year and spend an average of 20 hours per week providing care for their loved ones. Every day, 10,000 people turn 65 and bring with them unprecedented and widespread medical challenges because the elderly are having trouble both seeing and understanding their doctor's instructions. These numbers are important. 1 out of every 5 patients is readmitted into the hospital within 30 days of discharge, and 1 out of every 5 patients goes home and speaks a language other than English. Along with the growing population of elderly and chronically ill is an expanding immigrant community that often learns to speak but not read English. Health literacy is a big problem. According to the Center for Disease Control, 8 out of every 10 elderly patients can't understand the directions on their medical bottles. As a result of this lack of health literacy, patients often take medications on erratic schedules, miss follow-up appointments, and do not comprehend simple instructions like take their medications on an empty stomach. What is all this medical miscommunication costing you, me, and our healthcare system? The lack of literacy is costing us $238 billion a year in government fines, expensive readmissions, and loss of lives. That's a terrible amount of waste, isn't it? I'm not saying the system is broken, but I am saying something is wrong. For many elderly patients, the discharge instructions they are given when leaving the hospital or doctor's office can appear like the blurry text you see here. SpeechMED gives them their important medical information in an audio format. Along with the growing population of elderly and chronically ill is an expanding immigrant community that often learns to speak but not read English. SpeechMED helps to remove the language barriers by providing the care instructions and reminders in a language that they understand. So let me show you our solution. We call it SpeechMED Plus, a mobile voice platform that allows patients to hear vital medical information anytime, any place, and in any language. As you can see, we've divided the SpeechMED interface into 4 key buttons. There are also buttons for language selection and volume. It is very important to keep the interface simple and easy to use, or people won't use it. When you click on the Patient button, you can hear the list of medications, allergies, and appointments. These are all set to give automatic reminders at the proper times, but a list is sometimes very necessary as well. For example, when a patient visits a doctor or has an emergency. Transitions of caregivers becomes easier because everyone has the information that they need in the language they understand. Going back to Giselle's story, her family member could have listened to her pill reminder in English, Giselle could have listened to it in French, and her caregiver Marie could have listened to it in Spanish. Let's look at an example.
Good morning, Giselle. It is 8 a.m. Please take 1 Coumadin pill. After you take your Coumadin, please press the red button. Remember, you are no longer taking Plavix. Please make sure to throw away any remaining Plavix pills.
Bonjour Gisèle, il est 8 heures. S'il vous plaît prendre un comprimé de Coumadin. Après avoir pris votre Coumadin, s'il vous plaît appuyez sur le bouton rouge. N'oubliez pas que vous n'êtes plus le prendre Plavix. S'il vous plaît, assurez-vous de jeter les comprimés de Plavix restés.
Buenos días, Giselle. Son las 8 de la mañana. Por favor, tome una pastilla Coumadin. Después de tomar su Coumadin, por favor presione el botón rojo. Recuerde que usted ya no está tomando Plavix. Por favor, asegúrese de botar las pastillas Plavix restantes.
If we click the Allergies button, the tablet will say your allergies are strawberries, penicillin, and pollen. The General Care button shows the patient's care instructions. Instead of a mass of papers, the patient and their caregivers listen to their care instructions in the language they understand. Don't you wonder why this hasn't been done before? They can also be instructed on what to watch out for, what to eat, and who to notify if they have a problem. Again, this all happens in the language that they understand. And finally, the Resource button. This gives the plus to our tablet's name. Since our tablet is fully customizable, important documents like a living will, books to listen to, and videos can be all uploaded to our unit. Instructions are loaded onto a very user-friendly portal, where caregivers can have access to content and can quickly and easily edit it. To recap, the benefits of SpeechMED include appointment and medication reminders sent directly to the patient, easy transition of care from one caregiver to the next in the language that they understand, real health time state information, and contacts and resources available directly to the patient and caregiver. Thank you for taking the time to listen to our presentation today. If you'd like to contact SpeechMED, please dial 305-255-9600 or email our CEO, Susan Perry, at sperry@taylonis.com. Thank you.